The Pseudoscience of Aromatherapy, presented by Alexa Baylor, Matthew Torrell, Hannah Human, Brandon Seifert, and Yasna Hamadi.
Essential oils are compounds extracted from plants that are supposedly beneficial to health and well-being. They are mostly used in the practice of aromatherapy, which is a holistic alternative medicine practice that claims to help with anxiety, pain, and other physical or mental disorders. Essential oils can be used topically, orally, or diffused into the atmosphere in order to create an environment of utter peace and tranquility. Even though aromatherapy has been considered an effective method for reducing mild to moderate ailments, it is noted that experimental designs associated with examining the efficacy of aromatherapy have been flawed. In this lecture, the pitfalls of aromatherapy will be discussed and the solutions will be developed as to how individuals should go about using these plant-based treatments.
It is well known by scholars that aromatherapy came into existence due to the need to alleviate mild ailments and injuries without a strong foundation of knowledge in medicinal mechanics. In the 20th century, a scientist, René Maurice Gattefossé, had an incident where he was burned by chemicals in a laboratory setting. Gattefossé chose to douse his skin with lavender oil specifically, which proved to begin healing his skin from burn lesions in less than 24 hours. Amazed by the speed of recovery, Gattefossé began to conduct experiments into the efficacy of using aromatherapeutic methods for the sake of incorporation into mainstream medicine.
We are now going to look at aromatherapy through an economic lens.
Taking a look through the economic lens, aromatherapy sessions can cost anywhere from $45 to $100, and essential oils range in prices from $5 to $150, depending on the method of extraction or plants used to make the oil. This is important to consider when aromatherapy is marketed as having many health and wellness benefits. People who don't look deeper into studies or claims made on the internet could very well end up spending a lot of money on a treatment that hasn't been proven to have many real benefits.
We are now going to look at aromatherapy through a multimedia lens. Nowadays, use of alternative and complementary therapies with mainstream medicine has gained momentum. Aromatherapy is one of the complementary therapies which use essential oils as the major therapeutic agents to treat several diseases. The target audience in the market for aromatherapy is commonly women, but it is also growing significantly among millennials. This group of population is responsible for the changing trends in healing therapies. People are increasingly opting for natural therapies instead of man-made drugs. We are now going to look at aromatherapy through a scientific lens.
Taking a look through the scientific lens, it is important to note that 34% of Americans believe that there are health benefits associated with essential oil usage. However, interesting enough, 77.7% of Americans who self-medicate reported experiencing severe health-related issues due to the progression of illness. Using the scientific lens, we can deduct how aromatherapy can actually be harmful to societal health.
There have been studies on aromatherapy with claims that it helps with mental disorders, preoperative anxiety, and prenatal symptoms such as nausea and vomiting. Furthermore, aromatherapy is said to limit the growth of Lyme disease and provide osteoporosis or catheter insertion pain relief. All of these studies have issues with the way they are conducted or with the evidence that backs the results up. Trial size, diversity in the trial group, placebo effects, and minimal differences between trial group and control group results can all be examples of how these trials may fail to be conducted correctly. This could serve as the root cause of medical mistreatment because alternative medicine doctors use these studies to back up their claims about aromatherapy, and people who will not look deeper into these studies take these claims at face value. A study on how peppermint oil aromatherapy affects pregnant women who are experiencing nausea and vomiting was conducted. This was a randomized controlled experiment over the course of 7 days that took 60 women experiencing nausea and vomiting because of pregnancy. The experimental group was given 4 drops of peppermint oil in a bowl of water to sleep by, and the control group was given normal saline in a bowl of water to sleep by. The results showed little evidence in the use of aromatherapy preventing nausea and vomiting in pregnant women. The study did show, however, a decline in nausea intensity over the course of 7 days, especially on the 4th night for both the control group and the experimental group, but especially in the experimental group. These results are represented on this graph, with the date of intervention being on the x-axis and the means of the nausea on the y-axis, with the blue line representing the levels of nausea with normal saline and the red line representing levels of nausea with peppermint oil. These results hold little to no backing, though, because of the many flaws in the way the experiment was conducted. Firstly, the experiment uses a placebo for the control group rather than medications currently on the market to alleviate nausea. Secondly, the sample size used in the study is far too small to make any definitive conclusions about a decline in nausea for the pregnant women. It is also important to consider how factors like women's diets, age, and stress levels can affect how much nausea they experience.
In a review developed by Scuddery and others, aromatherapy methods and experiments have been analyzed in order to determine the efficacy of plant extracts in combating behavioral and psychological symptoms of dementia, such as aggression in Alzheimer's patients specifically. Scuddery and others claim that since contemporary antipsychotic medications, such as olanzapine, quetiapine, and risperidone, should only be used in the short term before the onset of side effects arise, it is important to investigate how homeopathic remedies can intervene at this critical stage. Therefore, Scuddery and others demonstrate that from 2001 to 2016, there have been an increased number of publications revolving around the aromatherapy field. 10,520 publications within the 2001 to 2016 decade due to the need to alter the pre-existing treatment plans for mental health patients. Upon further investigation and with the usage of meta-analytical tools, Scuddery and others found flaws in prior aromatherapeutic studies because research associated with the pharmacological mechanisms of plant extracts have been neglected. Furthermore, it was noted that a longer duration of aromatherapeutic implementation and greater sample sizes will be needed in future studies.
There is a clinical trial performed on 90 patients with osteoarthritis. During the trial, each patient was assigned to one of 3 knee massaging groups: massage with lavender essential oil, massage with a placebo, which was almond oil, or a control group with no massage. After massages or lack of a massage, the people were measured for how much pain they were in 1 week after the intervention and then 4 weeks after the intervention. They were tested using repeated Measure ANOVA and the chi-squared test. The results were that there was a significant decrease in the pain of the patients who were massaged with the essential oils. However, this pain relief was only immediate because after 4 weeks, the test showed that there is no significant difference in each group's pain. Although the group claimed to have pain relief immediately after the trial, the essential oils did not actually have any long-term effects. It is possible that even the immediate pain relief was only a placebo effect because the group believed that the essential oils would diminish their pain. Thus, essential oils seemed to have almost no effect on the subjects with back pain and definitely did not cure their conditions.
In a study conducted at Johns Hopkins University, essential oils were put to the test against bacteria Borrelia burgdorferi, also known as Lyme's disease. Researchers used 35 different essential oils and found that 10 essential oils at a low concentration of 0.1% have strong activity against stationary phase B. burgdorferi. However, the study then explains that the essential oils do not kill the disease. Higher concentrations are needed to eradicate the infection. If higher concentrations were to be used, the essential oils would become more of a harm than good. Essential oils are not a replacement for antibiotics, but can act as a supplement.
Essential oils, specifically lavender oil, are a simple method to relax the mind and drift into a deep sleep fast. Lavender essential oil supposedly has many other uses other than a sleep aid, such as inducing relaxation to treat parasitic infections, burns, insect bites, and spasm. But there hasn't been enough experiments performed to prove this hypothesis in its entirety. Essential oils aren't regulated by the FDA, so there's also no scientifically proven information regarding dosage instructions, side effects, or contraindications. The goal is to simply get the scent to your nervous system, and the easiest way to do that is breathe in. However, there are many mind tricks to help relax the nervous system without actually using essential oils. Some methods are getting the bedroom ready early, staying away from technology, and keeping the room dark and cool. Lavender essential oil may help relax the mind and influence sleep in the short term, but there are much simpler ways to fall asleep which can further develop into nightly habits.
In conclusion, it can be deducted that aromatherapy is considered a form of pseudoscience because experimental designs centered around using essential oils to alleviate ailments, as previously noted, are flawed. Individuals must be cognizant of trusting the claims of essential oil manufacturers and companies that utilize marketing techniques to make a profit based on the ignorance of their consumers. In order to alleviate illness, one should consider seeking professional medical advice instead of relying on their own inhibitions and self-diagnosis.